The NICU is overseen by neonatologists from the center. Please join me in welcoming Dr. Bernstein.
Good evening, ladies and gentlemen, and honored guests. And many years ago, as a young physician, I was faced with the dilemma of what to do with the rest of my life. All specialties in medicine seem to be so very exciting. In South Africa, my home country, one does a rotating internship, and I had just completed my stint in internal medicine. I was not sure what I wanted to do. A good friend of mine suggested, why don't you try and do pediatrics? I figured, well, why not? Residency in pediatrics required that I complete a year internship in pediatrics prior to starting the residency program. I applied and was accepted. My initial rotation was in the NICU at the Johannesburg Hospital. My first day in the unit was overwhelming. I could not believe that such small infants could survive. It seemed surreal. When the senior resident said to me, "Please go and draw blood from the baby in bed space 10, I almost fainted when I got there. The infant was just over a pound. That was my initiation to the NICU. And after 1 week of working there, I realized that I had found my passion in life, that is taking care of the ill newborn infant. Neonatology has come a long way, with survival rates and long-term outcome having shown significant improvement. However, we still have a long way to go. Not too long ago, the late President and Jackie Kennedy had a son born prematurely at 33 weeks gestation. There were no ventilators at the time in the USA, and the infant passed away. These days, it is very rare for an infant to die from those born greater than 28 weeks of gestation or even younger. Our equipment and knowledge and skills have improved in leaps and bounds. Even with this, we never stop learning. We still have a lot to learn. Premature birth still remains a major problem, with rates as high as 10% and more. We still have a lot to learn. The NICU functions as a team. In addition to the neonatologist, we are assisted by neonatal nurse practitioners who work under our supervision. They are very well trained. A neonatal nurse practitioner is a neonatal nurse who goes back to school and gets trained in the care of infants. I am honored to work with very talented neonatal nurse practitioners and colleagues. They are excellent clinicians and are a tremendous resource for patients and help us immensely. We also have a large team of neonatal bedside nurses who take care of the babies. They are very devoted, special people who become like surrogate mothers or fathers for our babies. In addition to the neonatal nurses, we have a team of pharmacists, dietitians, respiratory therapists, social workers, child life specialists, the HUCs, maintenance workers, the pastors, people who keep the NICU clean, all of whom are necessary for the functioning of the NICU, and all strive to ease the tremendous stress in taking care of these critically ill infants and their families. The job is very stressful. However, it is very fulfilling. My patients have taught me a lot, especially to be humble. It is very difficult not only for the parents and the families, but for us as well to come to terms with bad outcomes. We take it very personally, and one always beats oneself up at the end of the day. What could I have done better? I'm not a person who attends synagogue or church on a regular basis. However, in my heart, I pray every day for God to give me and my colleagues and staff the wisdom and the knowledge to make the right decisions for our precious infants and their parents. Finally, I would like to thank all the parents and families for bestowing on me and my team the honor of looking after their children.